Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes, and today we are going to talk about the writing because tomorrow we have an exam, and that is what we reserve this day for. That is to talk about the writing, not exactly the writing that can come in tomorrow's exam, but the pattern which needs to be followed for your exam. So that is what is the purpose of this class before your exam, so that you can follow the right pattern and you can be very productive in your exam. So I'm just going to start one by one and we'll take it forward. So first of all, see, there are many kinds of letter. First of all, this time I'm going to talk about discharge back letter first. So please listen to different kinds of letter and how to write about them. What is the grammar? So whenever you sit on in your exam, always make sure when it comes to the grammar, you have to create something like this. You have to write before your exam, always do this. Past, always. Uh, Second form, was plus third form. Always, any writing you are doing, and not even exam, rather I would say whether it is your exam or it is not your exam, doesn't make a difference. Every day, if you will practice, then it will improve. Present, has plus third form, and passive has been third form. This is the only grammar. If anybody says, because there are many people from you who will say, sir, I have studied from Punjabi medium, again, different regions, but it does not matter if you can do this small thing in your final exam. So I will write it down what you need to do. Half I have written, and now I'm completing it. Active, passive. In every exam, every day, you should prepare this chart and you should make it this way every day. This is the most important thing you can do. Active, and then you can take this thing. If I have to make it a little beautiful, I will do it this way. I will put, yeah, now it's better. And I will undo the stuff of my line. How can I undo it? How can I undo it? There must be an option of undo. Yeah, here it is. Yeah, that's the line. So I hope it is visible to everyone. I will just check it out. If you can put it on chat box, I would be really thankful. If you can see this grammar. Yes, sir. Okay, done. This you should do every day. Now I will tell you how to use it and how to use it for your benefit and what I mean by this. Past second form active. That means if I say patient came with chief complaint of fever, nausea, and vomiting. Second form came with. This is second form active. Patient came himself. I can also use patient visited with. So visited also will always come with second form. Patient presented with. So these are the options I have to start past tense. Means if I give you example, I will say on first visit, he complained of, or he visited with complaint of. The choice is yours. So complained is a verb. So you will use the second form. He complained of. Whereas if you are using the verb visited, then second wala would become noun. He visited with complaint of. Then you cannot put. So you can use either of this. So on first visit, he complained of fever, nausea, and vomiting, or whatever the symptoms are given. Suppose if the case is of diabetes and the person had defect in the eyes, he complained of blurred vision. So this is one of the symptoms of diabetes, blood visions, and other like urination, frequent urination, and all that stuff. Means what I want to teach you by this, that second form should be used for the active. Even if you say, sir, there are 3 past visits, so you will say on second visit, so you can use he suffered from, he complained of, or he on second visit he again had the same complaint, if he had the same complaint. Or you can say he again had the same complaint, or otherwise if you have used he visited, so you can say on second visit he presented with A, B, and C other symptoms. Means what I want to teach you at this moment is how to use the second form. First visit, second visit, if after 12 days, after 12 days, he revisited with complaints of XYZ. Means again, the thing that I want to teach you, that patient normally comes by himself. It is an active form. Second form, second form, second form. This is what I want to teach you by small thing. This is the grammar that you need to know. And when it is a passive voice means on examination. Passive voice means the things which are done by us. You know, examination is done by us. Us means nurses and doctors and hospital. On examination, he was found with elevated temperature and muscle tenderness. So these are known as signs. Signs. So signs usually come with was plus third form because they are found by us. Examination is done by us. So that is what is the main thing that you have to remember. And how can you do it? How can you follow it with the chart? How can you follow it with the chart? Here it is, was plus third form. Active, second form. Passive, was plus third form. Symptoms done, examination done. Then you will say, therefore, he was diagnosed with. Symptoms done, signs done. So obviously diagnosis will happen. So therefore, he was diagnosed with. This is the third diagnosis by the doctor or by us or again by the hospital. That is why was plus third form. Means what you are doing in the grammar, if you will understand what you are doing in the grammar, active when patient is complaining, active, second form. Passive, was plus third form. On examination, he was diagnosed with. Then you will say for which, okay, sorry, yeah, for which, comma, for which paracetamol or kuch bhi or whatever. So if the patient is of diabetes, for which insulin injection was given. Again was plus third form. Anything that is done by the hospital means examination is done by the hospital, that is a passive form. Diagnosis is done by the hospital, it is a passive form. By us. Don't write by us, you just need to follow all these things. I hope you are clear with everything. I'm just gonna ask you before I jump on to the next point. Any doubt in this thing until now? I have unmuted you. You can ask me any doubt until now in the grammar part. Any doubt, please, in the grammar?
Sir,
Yes, please.
sir, when we are writing that on first visit or second visit, then we have to write name of the person or not, or direct we can write he or she complained of that,
He or she directly can be written, not a problem at all.
and then okay, sir. Thank you.
Anyway, any other question by anyone, please? So should I take it positive?
Yes, sir.
Okay. So
Yes, sir.
that is the only grammar used in OET majorly, because even if it is a discharge letter, suppose, sir, we did not get visit letter, we got the discharge letter. So what you can do, I'm just gonna copy paste first visit. I'm gonna copy it and will paste it over here. Then on examination, again, I will cut and paste. So I'm not changing anything. I'm not changing anything. Now, if you will understand, on first visit, I will replace it by during hospitalization. Now, read it. During hospitalization, he complained of this and this. You cannot write visit because patient cannot visit in hospitalization. So you will remove this. He complained of A, B, and C. And then you will say on examination, he was found with this. Therefore, he was diagnosed with this, for which insulin injection was given. Simple, nothing. This is the most important tense. That is why this is easy and you just need to follow this. Please write it 10 times or 5 times, whatever suits you, but please practice it. Please practice it. You will never have problem in writing. Now coming to the next point, today visit. This is the only visit where grammar will change. If I can tell you simple, if I don't waste your time, second form will become has plus third form. So if it is a today visit, today he has complained. That is the only change. Nothing else. You don't have to do anything. And when it comes to passive voice on examination, can you help me, guys? On examination, if you can help me, guys, what should I replace was with? Was third form will become?
Has
Has
been.
been. Has been third form.
I'm just gonna do that. Today he has complained of this thing. So today he has complained, has, and then on examination he has been found with. Therefore, he has been diagnosed with this, for which insulin injection has been given. That is the only grammar of OET. And we all are medical professionals. We all know, we all are medical professionals, and we all know that first of all, symptoms will be there, which patient will tell by himself, subjective. Then signs will be there, objective. Signs mean what we found on the examination. That is why it would always be the second line. On examination, he was found with. Then third line, therefore he was diagnosed with. Then fourth line, therefore this treatment was given. Any doubts, guys, regarding anything, you can ask me until now. Please, you feel free to ask anything, guys. Please, anything.
Sir, one doubt. Sir, if you write the has been repeatedly, then it will not be a that repeated word are not
Ram sir,
good, sir.
when we talk about these things, again you can mute yourself, please. Ram sir, you need to understand one thing. When we don't mind this, he was found, he was diagnosed. It is a part of grammar. It is a part of grammar. So it can never be wrong to repeat. It is not connector. It is not something that is unusual because grammar they have created present perfect tense and there is only one present perfect tense. What can we do? So never doubt this. Never change this. Do you understand?
Okay, sir.
So we
Thank you, sir.
can
Yeah.
use was as well now.
Sorry, ma'am.
So we can use was as well
Me,
instead of has been.
my dear, suppose now very good question, Jobal. Like again, come to this point. Let's come to this. So in actual letter, you are saying on first visit, he presented with, then you are writing examination. On examination, he was found with. Then second visit comes. You are again using the same tense. Second visit. Again, past indefinite. Just like above. Then in the third visit, you are again using the same tense, just like these. So wouldn't you like that in today visit, you should use a different tense rather than present past indefinite, you should make it present perfect for a variation? Won't you like it?
Yes, sir.
So rather
But
than,
if we can use like was, then it will be wrong or
It can be right or wrong, but what I am saying is examiner will
Mm,
think that you don't know grammar, you know only past indefinite.
okay, sir.
And also most importantly, most of the visit letters in OET are like you are sending the patient immediately. So if you will write, therefore he was diagnosed with, again, this is role of tenses. This is what I teach in reading. This is what I teach in listening. On examination, he was found with, and you are talking about today. Therefore, he was diagnosed with this, for which he is being immediately referred to you. So you are using past and you are saying he is being immediately. So you say, on examination, he has been found with present. Therefore, he has been diagnosed with right now, and hence is being referred to you on urgent basis. That means I'm not wasting even a single second. It
Yes, sir.
makes more sense. Suppose this patient is of myocardial infarction. So today the patient has presented again with the severe chest pain, sudden onset of crushing chest pain. On examination, he has been found with this and this. Therefore, ECG has been conducted and ECG has shown elevated ST level or whatever, due to which he has been suspected with myocardial infarction, and hence is being referred to you on urgent basis. So we are all doing this in the present moment, that we did ECG and then this came and immediately we are referring to you. So we are talking in the present perfect tense. Do you understand, ma'am?
Yes, sir.
So it will not only give you variation, it will also become logical. It will also become relevant. It will also become rational. You will say we are just doing, and therefore we are referring the patient on the immediate basis. So suppose he has been diagnosed with, if I say myocardial infarction, for which he is being referred to you, he is being referred under your expertise on urgent basis. This will make more sense. Now see, today he has complained of sudden onset of crushing chest pain. On examination, he has been found with whatever signs are. On the basis of further, or you can say, yeah, further, his ECG has revealed elevated ST interval, due to which, nice connectors, due to which he seems to be a case of MI. Seems means suspected, then it would be a suspected case. If diagnosis is given, then you will say, therefore, he has been diagnosed with. Now see the connectors and see the variations. Today, he has complained of sudden onset of chest pain. On examination, he has been found with this. Further, his ECG has revealed, again, present perfect, active. ECG has revealed elevated ST interval, due to which he seems to be a case of myocardial infarction. Full stop. Now we can use therefore because we have not used therefore. And again, I have told you don't use too much connectors in one line. So now you break the line. Full stop. Therefore, now you don't need for which. Therefore, he is being referred under your expertise on. This will make more sense. Everybody all right with it? Please feel free to ask anything, please. This is the only grammar. Again, if you will see, we have changed the complete disease. We have changed the complete condition, but grammar has not changed. Why ECG is ECG has revealed, it is active. ECG has revealed actively. It's not a passive voice. Means X-ray has revealed fracture. Ultrasound has revealed ectopic pregnancy, whatever, according to the condition. Don't change grammar. So write it 10 times and confirm your 300 marks in writing today only. If you can score 400, wow. If you can do rest of the things better. But at least if grammar is better, purpose is sure, then nobody can fail you, at least in writing. That is the only point of writing. And see, this is the whole writing, grammar, everything. Now you will say, sir, you haven't talked about any other tense. But that tense you know now. Social history and other history. Second paragraph. He smokes. He lives. Or you can, in this, you can start with Mr. whatever. Mr. John lives with his friend, um, and does not have a stable income. He is a smoker. Simple, yeah, he is a smoker and drinks as well. Simple. His medical history reveals that he is a known case of whatever. This is the only tense that is left. There's no other tenses. This you can write. I know everybody can write. He lives, does not have, he's a smoker, drinks as well. His medical history reveals. All right. His past medical history. All right. His past medical history reveals this. And his family history, or you can say his father, also died of MI in 2001. Means if you're talking about past, then obviously you have to use second form, sorry, died, then second form. So don't make assumptions that, oh, I'm using the present tense, I cannot use the past tense. If you're talking about past medical history of father, so you will say, na, his father also died of MI in 2001. Or of, if you don't understand of, then you write due to MI. Simple means don't use anything complex if you want to pass in MTs. This is the maximum grammar. And first paragraph, you all know this letter is being written, or whether you want to write, I am writing this letter to refer Mr. John, who is suspected with MI and needs your expertise on urgent basis. How cool and easy. I'm writing this letter to refer Mr. John, who is suspected with MI. So when you will write the last paragraph, when you will change suspected word with seems to be a, then it gives you more marks because you have shuffled, you have shown that you have variation. Suspected becomes who seems to be a case of. So now if I arrange the paragraphs, cut. First paragraph, I'm writing this letter regarding this. Social history, cut. That becomes my second paragraph. This is your complete letter. It's not tricky, it's not difficult at all. That is what OET is all about. First paragraph done, second paragraph done, third paragraph, first visit. Oh, sir, can I make 5 paragraphs? Of course, 5 paragraphs, around 40 words each, means 30, 50, 40, 40, 38, 42, 5 paragraphs. Sir, can I make 4 paragraphs? All right. Makes those paragraphs in one. Or you can also, if everything is almost the same in 3 visits, so you can also write on first 3 visits. Again, grammar will remain the same. Again, what will be the grammar? Let me take it from here. On first 3 visits, he presented with this. On examination, he was found with this. Further, he was having this and this. Therefore, he was suspected with this, for which he was given this. You can mix it up. But today visit is most important. And only thing that will repeat is diagnosis of today in the first paragraph, MI, and in the first paragraph, MI. So you change the word who is suspected, who seems to be a case of. And again, sir, is it different if I write has been? Nobody, no problem at all. But in the last paragraph, don't use is. Always use has been. Due to which, like on examination, he has been found with. Don't write he is found with. Otherwise, you will not have the variations. Any doubt, please. This is small OET. That's it OET writing. Anybody who is new and has come from again any other medium, please write this 10 times. You will not have any problem in writing. Follow this pattern, fit the problems, conditions, fit the signs, write the same grammar every day. Don't change anything. You will pass. Anybody, anybody will pass. Just follow this. Now you have to use your brains a little. Now, what do I mean by this? Let me take you forward. I will take just 10 minutes more and everything of the writing would be covered. Sir, what are discharge?
Sir,
Yes, please. Sir, hold
sorry,
on,
sir.
hold on, hold on, hold on, hold on. I'm putting everybody on mute. We'll take your doubts afterwards. Really sorry, because don't want to break the flow. Now, discharge back letter. Very, very important. Discharge back letter. Now, please understand what is discharge back. Discharge back means patient is coming from somewhere to us and we are discharging back the patient to the same place. Now, how would it happen, sir? Suppose if patient is 70 years old and he lives in retirement home. Or suppose if patient lives in a hospice and he is in a palliative care. This is very important. Palliative care letters can come. They come after every 4 or 5 times. So this can be the time. So you should know the meaning of palliative care. Palliative care means suppose if patient is having terminal disease. Terminal disease means he's on the last stage, whether it is kidney disease, whether he's having cancer, whatever. He's on the end stage. He cannot be cured. Only his life can be managed. So patient lives in hospice. The place where he lives is hospice. So hospice people provide the palliative care. But suppose the condition became really worse. So we sent the patient to the hospital. Hospital hospital in hospital condition of the patient got improved. Not in terms he cannot be cured, but improved means again he became stable. At least he will not die. So now hospital is discharging patient back to hospice for the palliative care, continued palliative care. Are you getting my point? Patient having cancer cannot be treated. Condition became worse, so was sent to hospital. Hospital cured the person and sent back to cured means treated the person to at least make his condition better. Then he went again to hospice for the palliative care. So this can also be the case. In retirement home, patient can fall down, can have fracture. Then he went to the hospital, got plaster, and came back to the retirement home for the continued care. So now, how can you write this letter? Again, don't make OET difficult. Don't make OET difficult, just write simple. I'm writing. So suppose now you are from the hospital, you are a nurse from the hospital, and you are writing to the hospice or to the retirement. I'm writing this letter. I'm writing this letter, or this letter is being written regarding your resident, Mr. X, because he is resident of hospice, he is a resident of retirement. It can be a nursing home as well, where patient lives full time nursing home. So I'm writing this letter regarding your resident, Mr. X, who was admitted to our hospital due to fracture or or if is hospice or due to worsening of his diabetes. So it can be either or worsening of diabetes or any other thing. So you will simply write after treatment, his condition is better. Better means better than before. Therefore, he is being discharged back to your premises. You are advised to follow few precautions for his speedy, or you can't say speedy recovery if he's a hospice care. You are advised to follow few precautions for his. Normally, I write for his speedy recovery. So speedy recovery means if the patient is not the palliative care patient. But if the patient is palliative care, obviously he will not recover. You are advised to follow few precautions for his betterment. Let's make it simple. Means write as simple as you can. Or you can say you are advised to continue the ongoing care. Now, sir, where would I write continue the ongoing care? Just where it would be given. If it is given continue the ongoing care, then continue the ongoing care. If they say nothing, so you say follow few steps for his betterment. That's it. This is the discharge back letter. Now, second paragraph, in this kind of letter, you will never write social history or medical history because patient is coming from the same retirement home and is going to the same retirement home. They know about social history and medical history. So you will talk directly about during hospitalization. Now, what would be the grammar during hospitalization? H should be smaller or capital does not make a difference in hospitalization, but smaller is better. Again, same grammar. During hospitalization, he had or he complained of this. On examination, he was found with this. That means during the hospital, he was found with this. Further, his ECG revealed active second form. Again, I'm following the same grammar. Please never miss this chart because in exam you have to write one. Always make this chart. Always. So his examination revealed this. ECG revealed this. Again, same grammar. Due to which this is not required because he will not be found with anything. So again, same thing. Further, his ECG revealed this, for which he was diagnosed with this, but now it is not suiting for which. So due to which. Due to which means because of which. Because of which, because he was having this, ECG revealed this, ECG revealed this, due to which he was diagnosed with this. Now he is better. So third paragraph will become now after treatment he is better. So he is being discharged back. Now you will explain everything in detail. It, that he should be given this and this. If you want to add one more word, then suppose, please imagine, now he is better, so he's being discharged back. Now imagine. So what will I say? So that is the best word I can say. Once he reaches there, means at your premises. Once he reaches there, passive voice, he should be given this. Further, use further, more than often. Further, he needs to be given this. It is important to provide him this and this. That's it. That is the whole letter. Now, sir, it is only three paragraphs. There will be lot of things in this paragraph, like discharge plan will be big. So you can split the discharge plan into two just by doing anywhere in between. You can drop it down. So if you will see the tenses, he should be given this. He needs to be given this. It is important to provide him this. That is how you will write the grammar in the last paragraph of the discharge plan letters or in the discharge back letter. This, I think, is a very different letter and has not come for a very long time. If it comes tomorrow, then that's great. That's it. And Suzanne Matthews' letter, I have told everyone, I sent it to everyone. Please go through that letter again and again. So this is what you should do. I want to teach you just one more thing, referred back letter. Just last thing. Again, when we have worked so hard, what is the difference between discharge back letter? Discharge back letter means patient was living at same place. Now he is being discharged back to the same place. And referred back, only one difference is there. Doctor referred him. Doctor means his GP. His GP referred him to the hospital. We are the nurse at the hospital, and now we are referring the patient back to GP. That is the only difference. Discharge back letter means place from where the patient came and going back. Referred back means a doctor referred to us and we are referring him back. That is the only difference and nothing changes. Means if I copy paste this first paragraph, I will copy paste. I am writing this letter regarding your known patient who was admitted, or you can say who was referred to our hospital due to this. After treatment, his condition is better. Same, nothing changes. Therefore, he is being discharged. You won't say back to the premises. Therefore, he is being discharged. Now, when you are talking to doctors, even if he is a GP, so now you are requested to provide him or to continue the ongoing. Nothing changes. Nothing. Rather than place, you are talking to a doctor. I am writing this letter regarding your known patient who was referred to our hospital. Due to this, after treatment, his condition is better, so he's being discharged. Now you are requested to continue. That's it. Nothing changes. Even in this case, you can use now. But you cannot say now because patient is being discharged. So you will simply say you are advised to. Again, the better word you can say over here, once he reaches back to the premises or to your place, you are advised to follow. If you want to add, otherwise first one is also good. Don't overdo, don't overtry. If you cannot understand this thing, don't write this thing. If you can understand, once he reaches back, you are advised to follow few precautions. Simple. So please spend time with it. And last is Suzanne Matthews' letter that obviously you will find. I have forwarded the link to everyone yesterday. And I will also put that letter now in the thumbnail, means when this video will end, Suzanne Matthews letter will be visible to you. That's it about writing for tomorrow and for any exam. We have discussed all the letters. And again, if anybody does not understand writing, watch this video 5 times. Trust me, 5, it is 40 minutes video. 5 fours are 20. That means if you see 5 times, 200 minutes. That means only after 3 hours, you can, in 3 hours of watching 5 times this video, you can confirm that you will pass in writing. If you can prepare your OET writing in just 3 hours, it is not bad to watch this video 5 times. This is Dr. Bhupesh For you all, please go through. These are the maximum letters. Even for doctors and nurses, this is the maximum that can come. Again, different types of letter we have discussed. Hospitalization we have discussed. That means we have discussed the normal discharge letter as well. Then, sir, you did not talk about discharge plan. Nobody. I talked about the discharge plan. If you can see, this is how we write in the last paragraph of the discharge letters, normal discharge letters, the same as discharge back letter and referred back letter we have done. Again, in the referred back letter, because you are writing to the GP, you will not talk about the social history and medical history. The rest of the letter would be like this. Copy paste, copy paste. You will not write the word discharge back. You will not write the back to the GP. You will not say once he reaches there. Simple. He should be given. So understand, once he reaches there, you are talking to a place. You are sending it to a place once he reaches there. When you are talking to a doctor, you will say he is better, so he's been discharged. Now he should be given this, he should be given that, he needs to be given this. It is important to provide him this. Further, he should follow this and this, then that's it. Simple. Don't change grammars, nothing. All the grammar, everything that you say, sir, grammar. Again, if you are a new person coming from a different medium, suppose if you are Hindi medium, Punjabi medium, then you have to watch this video 5 times. But how to watch it 5 times? First, do one letter, visit letter only. First, learn grammar, understand grammar, watch this video until this point 5 times. Then do one kind of letter 5 times. Then do discharge back letter 5 times. Then do referred back letter 5 times. It will hardly take any time. Trust me, in third time you would have become an expert anyhow. Last 2 times we are just making it sure that nothing bad happens with us. This is Dr. Bhupesh from Dr. BKM OET Institutes. I hope you learned a lot and enjoyed the video. And tomorrow, again, referred back or discharge back letters or visit letters, these are the 3 letters which keep on shuffling. I should not say it, but I don't know. But palliative care is a very different letter, and I don't know why it came in my mind. It can be, it cannot be, can't say anything. But again, palliative letter is a very different letter. Or it palliative care does not mean only palliative care. Means it can be something like there is one more letter kind of respite care. Respite care means that if I am the nurse, I am giving my duty to other nurse. In that case, I will say this letter is being written regarding one of my patients, and now, or maybe one of the patients who needs respite care, that is why he is being referred to you. Means don't get scared if there is a word called respite care, so you simply say who needs respite care, and that is why he is being referred to you. Then you can mention about the care in the last. Don't get, sometimes it is like write an advisory letter. Advisory letter means that you have to advise, so it does not make any change. Advice means he should be given this, he needs to be given this. So in the first paragraph, I'm writing this letter regarding this person who needs this and this thing. Therefore, he is being referred to you. Same advisory letter. We are giving an advice. Kindly follow few precautions for his pediatric advice. Or should he needs to be given this, he should be given this. It is also an advice. So don't get scared. Nothing different can come in OET. This is Dr. Bhupesh from Dr. BKM OET Institutes. Please follow this letter to understand everything. And now I'm posting this Suzanne Matthews letter for you. Thank you so much.